partner with at Arena Labs, and what we do is we look at the future of human potential. We've been working with the Heart and Vascular Institute, so Dr. Doug Johnson has come out and is going to walk us through an immersive video. What you're going to see is a view inside the operating room. So Dr. Young has volunteered himself to do the demo live so you can all see what it's like in heart surgery. This up here on my left, your right, just quickly, what we're looking at, so my background was in special operations. The challenge we had in the military, just like all of you in medicine, is how do you train in that high-cost, high-risk environment? And the reason in the low-risk, low-cost environment we get very good at it, because we get good at pattern recognition, situation awareness, and that leads to low stress, low anxiety. And one of the things we've been exploring with Dr. Johnson and HBI is, can you train fear and anxiety management? And how do you do that in a high-risk, high-cost environment? So I'll turn it over.
So Jim, we're going to put the Oculus headset on you. It'll be a little snug with your glasses, but you'll start out with the surgeon's perspective in the operating room. Mark's going to help you kind of stretch this over the glasses here.
Got it.
So, and we're gonna make this even more real with some sound.
Uh-oh.
So the whole point of this is to give a view of the environment that's as close to real as possible. So you're going to start out in the surgeon's perspective, and you'll see as the view starts coming on the screen that this is an emergency scenario in the operating room. So a patient at the end of an operation who has been closed up and has gone into ventricular fibrillation.
So Doug, as a cardiologist, you must know that I've always wanted to be a heart surgeon, right?
So here's your shot. So as the video comes up, you'll start to get a sense of where you are in the operating room. Now you can look in all directions in 360 degrees. As you see it going live, you can see the resuscitation going on here. You can look down at the table. If you look behind you, you'll see the rest of the team. You'll see the view switching here. One of the powers of this technology is that we can show you the viewpoint of multiple members of the team. And so you're in an immersive environment, but we can put you in anesthesia perspective, in the scrub nurse perspective, and put you right in the middle of an emergency. So knowing what a smart guy you are, I'm going to assume that you've made some correct decisions here. But really, this would be the start of a scenario that's designed to get the resident in the mode, excited, fearful, and feeling what it's really like to be managing an emergency. So at that point, what we do essentially is to utilize multiple scenarios that come from a real operation that are divided up into short video clips. And so we can take the resident down sort of a choose-your-own-adventure book of making the right or the wrong decisions. But we'll assume that Jim has made the right decision, and what we can then do is bring it into a scenario where you've now resuscitated the patient, you've opened the patient up, gotten the heart restarted on the heart-lung machine, and here you can see the heart beating. If you look up a little bit, you'll see the heart monitor. If you literally look up right over the head there, you'll see the heart monitor with a good EKG trace. And if you look behind you, you'll see the perfusionist. It's directly behind you. You have to really turn around and look. So this is really in 360. So that's the person who's responsible for taking the patient off the heart-lung machine. And what we want to see here is that a resident who's doing this really utilizes all of the information in 360 degrees. So much like Uber is learning from where drivers look to look at how to work on self-driving cars, it's very important that we know that the residents are utilizing everything in 360 degrees, all information, to be able to make decisions properly. So you did a great job. You got the heart restarted, you got the patient back on pump, and now if you look down at the field, you'll see the heart filling with blood, and we're off of the heart-lung machine. Great job.
What can I say?
You're welcome in my operating room any day.
It's very impressive.